What's up, beautiful people? Another day, another study. Happy Juneteenth. Juneteenth is a big deal here in Texas. So, in honor of that, we have a study on Black men and women. So, this study was looking at meditation, a randomized controlled study for carotid intimal thickness, which is a surrogate marker for cardiovascular disease. And they're also looking at major adverse cardiovascular events. And we know that Black men and women suffer disproportionately from ASCVD, atherosclerotic cardiovascular disease, morbidity, and mortality. And that's partially driven by excess psychosocial and environmental stress. The mechanism behind that, and I've preached this from the rooftop for years, that stress changes our physiology. We know that these types of stress are associated with vascular inflammation, oxidative stress, reduction in the effectiveness of nitric oxide. You see changes in blood sugar and blood pressure and hormones. So there's lots of things that happen when we are under psychosocial stress. And psychosocial stress increases risk factors for CVD like hypertension, metabolic syndrome, dyslipidemia. Previous evidence suggests that meditation can be effective for reducing carotid intimal thickness and reducing major cardiovascular events. So this study looked at a transcendental meditation group. There's also a health education group, and they're looking at primarily carotid intimal thickness. And then they're also looking at some secondary measures like major adverse cardiovascular events. Compared to historical controls, both meditation and health education reduce the carotid intimal medial thickness. However, there tended to be a greater effect in those who had things like prior heart attack, hypertension, diabetes, cardiovascular disease, although it was not statistically significant. And then when they looked at major adverse cardiovascular events, there was a 65% reduction in MACE at 5-year follow-up. At 10 years, there was a 51% relative risk reduction. And what I love to see is adherence was pretty high for this intervention. They reported that 70% of participants were practicing at least once a day when they were interviewed in the clinic. And then when they did self-reported measures, it was 87% after a 12-month study period. So it's really encouraging to see studies like this adding lifestyle medicine on to standards of care and showing that lifestyle medicine interventions like meditation can improve outcomes.